It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. My topic today is making healthcare work. And on the subject of making healthcare work, I'm the panelist for today. And the reason we're doing this show, folks, is that Gary Fink, who is the president of TYG Media, asked me to do a special show on all the things he's heard me talk about over the year and a half we've been working on television shows and addressing different changes in the healthcare system, the healthcare delivery system, what private citizens need to do and what they need to know in order to make the healthcare system work for you. Healthcare delivery is changing. It's changing because the laws have changed. It's changed because we're living longer. The average age of people living in the United States has greatly increased over the years. A number of us believe firmly that when we started the Medicare system, that we never contemplated that people would live as long as they're living today. So in many cases, we outgrow the healthcare system. Does that mean that we give up? No, not at all. It just means that we have to try to be a little more innovative, address our problems a little harder. And I recently did a show for our website titled Thinking Out of the Box. And the show Thinking Out of the Box was designed in part to start you, the viewer, thinking about what you could do better, what you could certainly do more of, and how you might better plan for the future. Now, we have done all types of shows over the years that I've been doing this series of television shows. We started off with an Aging with Dignity series. I produced those for the Brevard Alzheimer's Foundation, and we were on Bright House and several other stations for about 6 years. Those shows addressed legal issues, medical issues, just plain old living, and how we can make the system work for us. But underlying the whole business of care has been a basic factor on how could individuals pay for this care. What could we do to better plan for the future? In that regard, Bill Johnson, an elder law attorney, has been one of our panelists from almost the very beginning of the radio show, Focus on Seniors, originally called the Elder Hour. And Bill has talked about the legal issues, guardianships, the documents we need to put in place so that we can prepare for the end of our lives, how we can make things easier for our families, how we can do a better job of planning. That involves estate planning, it involves medical planning, it involves legal planning. There's just so much that has to be done. So, in thinking about all the very complex factors that comprise the healthcare delivery system, we tried to think of ways that we could maybe help explain everything in use the word lucid, because healthcare delivery can be very, very complex. And the sad part about it is that it does not have to be complex. So what we want to do in this very short period of time is talk a little bit about our radio show, our television show, our newspaper column, our website, and how we can make all these things work better. You know, the Florida legislature in, I think it was 2012, 2013, passed some new laws on Medicaid managed care. Now, I want you to think about this now. There are roughly 320 million people in the United States. Over 50 million are on Medicaid, not Medicare, Medicaid. Medicaid and Medicare are different. Generally speaking, Medicare provides for hospital stays and skilled nursing care, whereas Medicaid has now been brought into the insurance equation for people less than 65 years old. There is a lot to understand, and in the space of a 28.5-minute show, there is no way that I could explain to you all the nuances of how all these systems fit together. But if you will take heed of what I'm saying on this show, go back to our website and think and look at some of the other shows, you'll start to see how you can help develop your own aging and care plan. Is it going to be perfect? No. But it will be a step in the right direction. It was in the year 2000, on December 7th, that we aired our first radio show. And when we aired that first radio show, it was the third radio show in over 11,000, that's right, 11,000 radio shows in the United States. It was only the third one that talked about senior and aging issues. Several stations that carried the show, recognizing the potential value of such a show, asked me to move the show to Los Angeles, where I would have had an immediate viewing audience or listening audience of over 10 million people. I said no. And the other night I was going through my old files and I pulled out the offer from Talk One Radio. And I thought back over all these years of my decision to stay here and try to improve local awareness of how we could better help ourselves. And I think I made the right decision. I know I did. So we are still building on that radio show. That radio show exists today. It goes on the air. It's aired every Thursday morning at 9 a.m. on radio station WMEL AM 1300. And that show is then put into a podcast, and it is archived on our website, helpingseniorsofbrevard.com. helpingseniorsofbrevard.com. In 2007, after having read Florida Today newspaper for a number of years, and there was a columnist in there from Los Angeles named Bard Lindeman. And Bard Lindeman talked about senior issues. But there were national type issues, not what was happening in Brevard County. And I thought about that. I thought it's extremely important that the people in Brevard County have a better idea of what is available to them, how they could access these services, and how they could make these things work better for them. Brevard County, Florida is something in the order of the 7th oldest county in the United States, and that's in about 3,060 counties. But it is the 7th oldest in terms of the number of people over the age of 65. So it behooves us in Brevard County to develop a better aging plan. Are we there yet? Not at all. Not at all. Are we getting there? I hope we are. But we'll only get there if you, the viewing audience, think about what I'm talking about and make a decision that you want to become involved in helping develop an aging plan for yourself and how we might all participate in developing an aging plan for all of us. So we have the the radio show. Then in 2007, we convinced Florida Today to start a column called Focus on Seniors. I look back over, I've kept a copy of every one of those columns, and we talked about situations that elders find themselves in. Finding themselves in a position where they're forced into a nursing home or an assisted living when they don't need to be there, when they can do a better job of staying in their own home. And this is what most people want to do. I did a television show recently on a program called Seniors Helping Seniors. And after the show was over, the young woman and her mother that owned this company told me about a situation where they have an aging couple, elderly couple, that they go in and help 2 hours a day, every day of the week, and the total cost to that family is $960. Now, there are things like cooking, transportation, getting to a doctor's office. Once they're in the doctor's office, making sure that they understand what the doctor's telling them, sorting pills out, doing things safe in their home, fixing a light bulb, but not doing it themselves, not getting on a ladder. This company, for $960, does all those things. And did this couple not have that company coming in to help them, they would be forced to go into an assisted living facility. A good ballpark cost for the assisted living facility is about, for two people, $7,000 a month. So for $1,000, they can stay in their home, save money, and be happy. Now, there's another complex set of facts that enter into whether or not people can do what I've just described. Do they have the money to pay for it? If you live on an income of $1,700 a month, it'd be very difficult to pay $1,000 just for that element of care. So you have different new programs that the country has started called Medicaid, Medicare, and different types of care, such as long-term care insurance, private pay insurance, and the Medicaid managed care, which will help keep seniors in the elements of care that are less costly. Now, do you just walk into a store and say, I want to sign up for Medicaid? No, that's not the way it works. There's a number you have to call. And I could preach, write, and talk about this till I was blue in the face, but there's a number for the Aging Disability Resource Center, and it's a national number, and I've got it here in my notes. I'll find it here. The number is, it's an 800 number, folks. 800-963-5337. 1-800-963-5337. And that single number puts you in contact with the Medicaid program. That's the only way you can start it. You can't go to the old CARES office. You can't go to Aging Matters. You can't go to the Memory Disorder Clinic. You can't go anyplace and start this program. You have to go to the Aging Disability Resource Center. That's the way it works. The state has tightened up on these programs. So once you get into the Medicaid system, if you qualify, and there's some basic guidelines, roughly You could have $2,000 in spendable assets. Your spouse could have up to roughly $102,000 in assets in an account. You can own your own home. You can have your car. And if it's a couple, you can have an income of roughly $21,000 or $22,000 a year. But those are just guidelines, folks. Those are basic parameters you need to make that phone call so you can explain exactly what your situation is and how your situation can be used to help you access care. Now, the Florida legislature, thinking they're doing something really good, changed the law on Medicaid care. And we now have what we call Medicaid managed care. And under the Medicaid managed care, we have roughly 11 or 12 organizations throughout the entire state of Florida that serve the 67 counties in Florida. And what this means is that there are 4 companies that serve Brevard County. And those 4 companies receive a stipend of roughly $1,300 a month, out of which sum care is doled out to the people that qualify for the Medicaid managed care program. That's not a lot, but if you have a good plan, if you've gone and worked this out with an elder law attorney, you might be able to use the Medicaid managed assets, your private assets, and have a better chance of developing a care plan that will take some of the stress off of you trying to figure out how you're going to care for yourself. I can tell you honestly, unless you try to do this, you will not have anything. You just won't have it. So now what do we have? We have the radio show. We have the newspaper column. We have this television show. And a television show has all kinds of programs that address senior and elderly aging issues. We have shows that talk about legal issues, guardianships, estate planning, finances, medical care. But we're also finding out that there's a lot more that we need to understand. A very misconstrued topic is terminology. So many people, as much as we talk about Medicare and managed care, still don't understand the difference between Medicare and Medicaid. They don't understand that there are specific guidelines that we have to follow to make these programs work. But that's all part of what we're trying to address in our Medicaid type shows, our legal shows that are done on the radio, talked about in the newspaper, and put on the television stations. We're on Bright House 3 days a week, Monday, Tuesday, and Thursday. Look in the paper for the local times. We're also on the Space Coast Television, Channel 199. We hope to be on other channels, and we will be, because the value of this information is just starting to catch. So many people think that all this information is already available, and especially maybe by calling 211. 211 can give you the name of a source or a service to call, but it's not going to help you put a plan together. And that's what this new organization, Helping Seniors of Brevard County, which I'm talking about today, is trying to do. We are working on the development of a partnership with Wistoff Hospital Systems, such that we will have offices in several of their locations where we will have counselors, so that if you call the Helping Seniors number 473-7770, if you call that number, tell them what your problem is, the counselor will be able to guide you in the direction you need to proceed in order to develop your aging and care plan. Most people are terrified of going to an attorney. They think right away they're going to incur a tremendous amount of expense. I talked to Bill Johnson, an elder law attorney, one of the very few certified in Brevard County with the type of degrees that he has and certifications to practice elder law. And Bill has assured me that his consultations, his first hour, is free. You might, through the services of a free hour of consultation, be able to figure out how for maybe $5 or $6 or $7 or $800, you can put an estate plan in place, put the proper papers in place that will prevent you from having to undergo probate expense or a contested guardianship, which starts out basically at least $10,000. We just simply don't understand the ramifications of all this. One of the shows that we will do that will be on this network is a show about understanding terminology. And Mrs. Deerdorf, who is a registered nurse and a branch director for Gentiva Healthcare, probably as knowledgeable in this area of terminology as anybody I've come across in 25 years of working with seniors, is going to talk about terminology on a 28.5-minute television show. She will help you understand what some of these things mean so that when you talk to a counselor, you have a better idea of what to ask, what's important, and what's not important. So now we have a radio show, a television show, a newspaper column, and we have this website. And the website the address for that, the internet address is helpingseniorsofbrevard.com. And on that website, you will find a wealth of information about things you need to understand so that you can help develop your own aging and care plan. All of the radio shows, the Focus on Seniors columns from the newspaper, the television shows, they are all archived on this internet, on the website. You can look up the topics that you want to see, and you can read about it. And if it triggers questions in your mind, you can call that number 473-7770, and they can help you understand what you don't understand. We are going to be forced, folks, in order to think more clearly, more strongly about how we can develop a care plan for ourselves that lets us use less expensive elements of care. We have a country of roughly 320 million people. Over 50 million are on Medicaid. With the new changes in Florida law, we have gone to the Medicaid managed care, which is privatized care, and we have 4 organizations that serve Brevard County. At my last readout, 2 of the 4 organizations were not even taking phone calls to discuss the delivery of care. What does this mean? To me, it means that we have to think very clearly about the changes we enact to our laws. Organizations exist to make a profit. Organizations exist to provide care. It's up to us to develop our own capability and ability to access these elements of care. Personally speaking, I have been very fortunate. I have a good knowledge of how to make the system work for me. But having said that, I think the United States of America and Brevard County in particular is blessed to have such things like Social Security, Medicare, Medicaid, Medicaid managed care, assisted living facilities, long-term care plans. But the thrust of what we need to do is to have a better understanding of how all these things work. Some very, very important phone numbers are the ones I'm giving you. If you look on the website, you will see a section on the website called the Assistance Sheet. Every phone number that I have given you is listed on that assistance sheet. For those of you that are watching this broadcast and live in Mickle, Florida, and might want to go to Palm Bay or have to go to Palm Bay for a doctor's visit, if you can't drive, the cab fare is roughly $74 a round trip. If you're wheelchair bound, it costs even more. But you can call an organization called the Space Coast Center for Independent Living at 633-6011, and they will pick you up in a wheelchair-equipped van, take you to that doctor's appointment, stay with you, listen to what the doctor has to say to you if you want him to make sure you've got it right, and they will take you home. That trip will probably cost you around $30. These are your tax dollars working effectively for you. There are programs that can help you do a job of devising and developing your own care plan. But how you do so is up to you. You can do it smartly or you can do it dumbly. I would recommend that you do everything you can to make the smartest decisions possible. And by making smart decisions, you learn to use the assets that are available to you that we're talking about on radio, newspaper, and our television show. I want to thank you for watching today's episode of Focus on Seniors. If you have questions or comments, please call us at 321-473-7770. For more information on senior care and resources, visit our website at helpingseniorsofbrevard.com. Be sure to listen to the Focus on Seniors on radio station WMEL 1300 AM every Thursday morning at 9 a.m. and look for us in the Florida Today newspaper health section every Thursday for our Focus on Senior column. I'm Joe Steckler, and thank you for joining us today for Focus on Seniors.